Hi, Sister Cynthia.
Welcome to Expand Your Horizons. Our topic is investing in our children. We are focusing on childcare access, affordability, and workforce pay. Expand Your Horizons is an informative gathering of hosted by the Notre Dame Sisters and Associates. The event topic is about children, and this event is rooted in the call of the gospel, which echoes in our hearts. Whoever welcomes these children welcomes me. Whoever welcomes me welcomes the one who sent me. For many years, the Notre Dame Sisters have been working with families with women, and more recently, with family violence. To do this, we are partnering with professionals over the years, and this is how we have been investing directly in children. A partnership developed with Catholic Charities to assist women and children fleeing domestic violence. Catholic Charities created a plan, and the shelter was established in 1978. The need for help with utilities and rent when leaving the shelter was an issue from the very beginning. Funds were raised by the sisters, soup suppers, all kinds of different things, crafts, and the staff helped out. Eventually, research began by members of the Notre Dame Sisters Social Justice Committee. Motivated by a vision of service, the committee could see that the data clearly indicated that there was a need beyond what Catholic Charities was able to do. Thus, Safe Homes was born, and it was developed by the year 2000. We invite you now to watch a 4-minute video that describes how Safe Homes is a ministry that is truly investing in children.
To sustain that. Two critical parts of domestic violence is getting away from the abuser, that's them entering a shelter or program, and getting out of the shelter into independent living. So that program, we provide first month's rent or rent deposit or utilities. And we work with 6 agencies doing that. And that's been going on a long time.
I think when someone is leaving an abusive relationship, they are stripped of pretty much everything. They don't have the skill set a lot of times, the financial literacy, the credit score, the knowledge about how to get into a place, or even the financial ability to be able to afford a deposit or a first month's rent.
We also have another part of that's called keeping on, and we have one of the sisters who calls this woman if she wants to be called and offers support, not case management, but support. That's where we spend most of our time and energy raising money for that.
Here's the difference that I've seen with Safe Homes versus other programs is that Safe Homes has an incredible follow-up with the women, but they are very careful to follow up with the women to make sure that this is something that's working. They stay attached to these women, and that's what makes that program unique. It has been a wonderful resource for the women that we've helped.
I lived in Houston, Texas for 5 years, and my husband ended up getting mixed up in some bad things. And when it trickled down to affect my children, eventually couldn't take it. So I left Texas, came back to Nebraska, which is home for me. And Catholic Charities helped me. They kind of housed me for a couple months, and they are the ones that suggested I talk to the sisters, and I got a hold of Sister Mary Alice, which I've got to tell you, she's one of the most inspirational people I've ever spoke to. Children's Hospital actually helped me get in contact with Catholic Charities. Catholic Charities helped me get in contact with the sisters, and the sisters helped me get into my apartment. If you work the program and you like, just stay positive. And that was another thing Sister Mary Alice just kept saying, just stay positive. Just focus on what you need to do, then you'll get there. I want to say thank you to the whole program, because not only did Sister Mary Alice really make it a point to, know me and my family, and to kind of just be not a full-blown cheerleader. Like I said, what she would say to me was so simplistic and yet still so divine that it really stuck with me and just encouraged me so much on the hardest days. But she also knew the community and all of the resources. There's so many resources that really actually help.
It's so important. Safe homes is so important to the community. I mean, because by safe homes helping one woman who probably has children, it creates a better family. And so those better families have better children, and those children, it's kind of just a cycle. So it just goes out. Better children, better adults, better humans, and just creating more safety and love.
Creating safety and love. That's what partnership is about for us when it comes to how to work with the women who need safe homes. As stated in the video by the lady toward the end, better families, better adults, better children, better humans. What more can we ask? Creating more safety and love. And many resources. So the mom in there was speaking, she spoke about the many resources that Safe Homes was able to provide her through the Keep It On program after they leave and are settled into an apartment. So these many resources are available for safe home parents, and they have developing children most of the time. So what is present for them? And that's kind of what our program is about this evening. What about the need for childcare? What are the issues? So I started seriously thinking about this back in June, was listening to the tax credit, listening to things on infrastructure. And I realized that Theresa Wiggs, one of our associates, was an early childhood professional. So she got many calls and texts and emails from me as we tried to figure this out. She will be providing an overview and will facilitate the conversation that we planned. Our guests, okay, there she is. Our guests include Theresa, and she has two friends, one from the, well, many friends, but the Hills Montessori Child Care Center and the Life Changers Academy Child Care Center. The three of them are going to have a conversation and lead us into the more of the program. We have representatives from the Nebraska Early Childhood Office, and you can see on there, it says that their focus in this for us would be the birth to 5. There's many more childcare places, but ours is the early childhood focus in this event. We also have representative from the Catholic Charities. One of their programs is mentoring moms. We have Voices for Children, and I had visited them early and found all that research and the kids count, so I did a lot of reading. And then in the last couple hours, practically, we have a representative for the wage issue that's out there, and you will hear more about that from representatives from Nebraska Appleseed. So at this time, I'm going to stop share and let you see our people. So these are the guests we have with us, and I'll let Theresa start, and they will just give their name and then their, I'm sorry, Molly, you've already met, but Molly, is she, okay, yeah, there's Molly someplace. Okay, so Molly will be saying just what her role is, and then after Molly will be Theresa.
Sorry, I had to unmute myself. So thank you so much. I just work with communications with the Notre Dame Sisters and help these live events take place. So we are literally in a gallery of experts right now, and I'm happy to throw it over to our next expert.
Teresa?
Hello, I'm Theresa Wiggs. I own the Miss Teresa's Nature Center, a Montessori environment. And Davida?
And hi, everyone. I'm Davida Anderson with Life Changers Academy Early Learning Center.
Okay, Dina?
Hi, I'm Dina Johnson. I'm with the Early Childhood Training Center.
Joycelyn?
Hi, I'm Joycelyn Hardy. I am the Mentoring Moms Coordinator for Catholic Charities.
Robin? You have to unmute, okay.
Hi, I'm Robin Colgan. I'm the Assistant Administrator at the Hills Montessori School.
Alfonso?
Hi, my name is Alfonso. I'm the Research Coordinator at Voices for Children in Nebraska.
Aubrey?
Hi, I'm Aubrey Mancuso, and I am the Executive Director of Voices for Children in Nebraska.
Selena?
Hi, I'm Selena Martinez. I'm the Field Director at Nebraska Appleseed.
Okay, Melody?
I'm Melody Hobson. I'm the Administrator for the Office of Early Childhood at the Nebraska Department of Education.
And then I have, there's a name here, Tori.
Hi, I'm Victoria with Voices for Children, or Tori, I guess.
Okay, thank you. Okay, so we're ready to move on. And Molly will be watching for questions on chat, or anyone on our Zoom that sends a question that's in addition to what we've already been working with. So we invite all the participants that are watching and being with us on Facebook to send us your comments, questions, and then we will include those toward the end of our program this evening. So we're now going to begin with Theresa. And I have to.
Thank you, Sister Cynthia. I'm happy to be here tonight to speak about a topic that's near and dear to my heart. Investing.
Before she speaks of near and dear to her heart, Cynthia was supposed to say more about you, Theresa.
Sorry.
I know, I knew I would goof this up if I didn't watch this paper here. Okay, so Theresa is a wife and parent, and I'm going to do my slide share because that's what I was doing when I got distracted by myself. Okay, so there she is on my thing, and then Theresa's over there on the, okay. So Theresa is a wife and parent, a Notre Dame associate. She's a volunteer at Heart Ministry. She's a mentor for families, refugee families, and she's active in some of the OTOC, Omaha Together One community. Since graduating from the College of St. Mary in 1980 with a degree in early childhood, Theresa completed Montessori certification and earned credits needed for a teacher's license. She has been a substitute teacher, served as a consultant, and provided trainings for teachers. And she's been advising me for the last 3 months. Theresa has a small business owner experience setting up and operating her own Montessori preschools in Nebraska and Kansas. I also want you to know she's a musician and has self-published 40 children's songs. So with Theresa's wide experience, she helped this presentation on significant aspects of early childhood development. It's a whole industry that I learned a lot about, and our focus is on access, affordability, and workforce pay. So I let Theresa now, as our facilitator, begin her overview.
Again, thank you, Sister Cynthia. I am happy to be here, and the topic of investing in your children is one that I'm always ready to talk about. As a Montessori educator, a mother, a daughter, and a sister, I've had many opportunities to think about, discuss, and work with children and their parents to help them choose schools and in general raise their children. As a mother of 3 adults, I am most proud of the 3 people I raised and put into the world. I have also had a satisfying career as a Montessori educator, yet in thinking about this program, I thought back on my most important job, and that was raising my children and supporting them and making good choices for them. Investing in our children is a very broad topic, and we will be focusing on the aspects that Sister Cynthia mentioned: access to affordable childcare, and also what workforce pay does to the industry. And we'll explain more about that soon. It is very important that we all become invested in the very youngest of our children. Birth to 5 years old, as Maria Montessori, the respected educator and creator of the Montessori teacher method, says, the absorbent mind accepts everything, puts its hopes in everything, accepts poverty equally with wealth, adopts any religion and the prejudices and habits of its countrymen, incarnating all in itself. This is the child. Investing in young children is beneficial to all of society. Our children that are loved, nurtured, and safe will benefit their whole life. They will reap those benefits for a lifetime. Sadly, children that grow up without these essential needs met will struggle and need costly help from society to grow and reach their potential. Tonight, we'll focus on working parents raising young children. All working parents, regardless of their financial situation, must find childcare for their young children if they're to go to work. As we've seen in the pandemic, it's difficult to work with the children at home. When I was a young mother nearly 40 years ago, I chose to be a stay-at-home mom. As I look back, I realize how privileged I was to even have that as an option. Back then, but even more so now, very few people can or want to make that choice. That is to leave their job when they become a parent. In the United States, maternity and paternity leave is very short, lasting only 8 to 12 weeks, and many jobs provide no paid time off when a worker becomes a parent. Many parents in need of childcare choose to enroll their children in a licensed childcare facility. Other parents have the option of in-home care, such as hiring a nanny, babysitter, or a trusted relative like a grandmother or aunts and uncles. Research says that these caregivers have a lasting impact on the children that they care for. Therefore, children benefit if these caregivers have access to training and to meet the emotional and educational needs of these very young children. As I said before, 0 to 5 is an essential and critical time of life for children. Our talented and knowledgeable panelists we have gathered tonight will help us understand the roles of the community, government programs, and other support for caregivers, both licensed and informal caregivers, can use to support the children they care for. Unfortunately, we will also hear about challenges and inequities that exist in our society. Too often, parents and children lack access to the high-quality childcare we've been speaking of. And tonight, our speakers will help us understand both the benefits and challenges families face while raising young children. My conversation with the experts will focus on the three important topics that Sister mentioned earlier: access to high quality childcare, challenges to afford that care, and what workforce pay, how it affects the industry, low paying jobs for the caregivers, and also low wages that parents may have that limit their choices. We'll begin by, I'll have an interview with Davida, who's here with me, and also Robin. So Molly, if we could have those three on the screen now, please.
Absolutely.
Thank you. We'll go ahead and begin. When Sister Cynthia asked me to participate in this program, I thought of two schools that I've worked in, and two owners that I had experience speaking with a lot of these issues with. Becky owns or operates, directs the Hills Montessori Child Care and Learning Center. And she couldn't be with us because it's her birthday. So happy birthday, Becky.
Okay.
But we're lucky tonight to have Robin Colgan. I hope I pronounced your last name.
Colgan.
Colgan. We go by first names in the classroom. It's Miss Robin, usually. Thanks for being here.
Thank you.
This is Robin Colgan. She is the assistant administrator at the Hills Montessori here in Omaha. She has over 30 years experience working with children of various ages, both in public and private schools. She maintains Nebraska licenses and certifications to teach K through 12. That includes elementary and also preschool education. The Hills Montessori is located at 6210 North 107th Street. They offer a wonderful Montessori program at a lower cost than many of the Montessori schools here in the area. I have had the occasion to work at this school, and I've observed that the staff, the administrators, provide a caring, nurturing environment. They have well-trained staff. And Robin, thank you for joining us to discuss investing in our children.
Sure. Thank you for having us.
My first question is about access. You have a wonderful school there, so I imagine it's popular. Have you experienced long waiting lists? And if so, can you speak about access to childcare in the area?
We do. We just won Best of Omaha for the 8th year, so we get a lot of inquiries into our school.
Congratulations.
We're on a wait list for our baby rooms until next summer of 2022. So you almost have to get on a wait list right when you find out you're pregnant to get a spot for a baby room. For our preschool and tot rooms, it's a shorter waiting list. Normally a few weeks to a month, someone will move up or leave and we can get a spot available, especially for our daytime or academic hours.
Thank you. I've participated in some of your on-site training. Can you tell us about the training that you provide your staff that goes above and beyond what Nebraska requires, and maybe some of the benefits that you see because you provide that extra training?
Sure. We like to provide as much Montessori training as possible, of course, so people understand the philosophy and can apply that at our school. We really want to be as pure a Montessori as we can. On top of that, of course, we do the 7 domain trainings. So we do social emotional approaches to learning, health, physical development, language and literacy development, mathematics, science, creative arts. Once people are through those, and we offer all sorts of additional trainings with creative things. I think you came and did one on art one time for us.
Art and music.
Yes, art and music. And of course, all of our staff also takes Prepare to Care, Safe with You, and are CPR certified. We currently have one staff member who is doing her Montessori training through University of Kearney, and she's doing her internship with us right now.
Wonderful, thank you. And my last question for you is about intergenerational program. I know you, before COVID, you had some grandparents coming on a regular basis. Can you just tell us about the benefits of the intergenerational interactions? And then also if you're able to welcome senior volunteers now.
Sure. We were working with Newcastle, and we had some great grandpas and grandmas who came and held babies and rocked babies, which is great to have that extra attention for those that aren't being cared for at that moment by our staff, since we are a 4-to-1 ratio. They also had grandparents that came and listened to readers or did other things with us. We're not doing that with Newcastle right now due to COVID, but we would love to have any other volunteers who feel like they're healthy and feel comfortable. We would just ask they mask and take do the background checks in order to come to our school. We also would welcome anyone who wanted to volunteer to do cutting or make materials or work, at home also, if that was more comfortable for them.
Thank you, Robin, and we'll come back to you later in the program.
Okay, great.
I'd like to introduce Davida Anderson, and Davida is here from Life Changers Academy. She actually is a leader in creating this franchise. I've had many conversations with Davida about early childhood education and the Montessori method. I also enjoyed touring her location at 5829 Hampton Boulevard here in North Omaha, Nebraska. Davida has decades of experience in educating and has developed programs for children in Omaha area to meet their needs for authentic education. She works with infants, toddlers, preschoolers, and school-age children. Many working parents choose to enroll their children at Life Changers Academy because she offers affordable childcare. They strive to provide a pleasant experience and exceptional results for each child and each parent. When Sister Cynthia asked me to be involved in this program, Davida and her school was one of the first things that came to mind, because I can imagine, and we'll talk to her about the challenges she faces to work with the budget she has. And so we'll start with asking questions. Thank you for being here.
Thank you for having me.
So same as asking Robin, do you have waiting lists, and can you just speak a little bit about access to childcare with the parents that come to enroll?
We currently have a waiting list for our infant and toddler classrooms. We have more availability now in our preschool classrooms and with our school age, because school has started back. But I'm sure when we were in full-blown pandemic, when COVID first hit, and with us trying to do the virtual learning and everything, we had a lot of children and we had to make a lot of adjustments. So we do have a waiting list for infants and toddlers.
Mm-hmm. Sounds like that's industry-wide. We need more spots for infants and toddlers, it sounds like.
Yes.
So can you speak a little bit about the tuition that you get from your parents, and is the main source government subsidies?
Yes. Okay. I would say that 90% of my program is my parents receive child care subsidy, and then about 10% is private pay.
And are there some challenges you have with that for your budget, and would there be some grants or some other ways do you apply for grants as well?
I don't know of any grants that would help in that particular would help with tuition for the parents, but I have to include in my budget where I do sometimes allow the parents to, I may waive their copay. So where the state subsidy will pay 100% of, or won't, they'll pay maybe 90% or 75%, I should say, of their tuition, I may have to waive the other portion of it. So
that sounds challenging.
Yeah, so I would have to give them a discounted rate.
Okay, thank you. And my last question is about the help that you need to give your staff to get the certification so they stay current with Nebraska requirements for staffing. Do you help them with
I
getting
usually
that?
have to pay 100% of that. If I want my staff to have the training that they need and that's required by the state, as she mentioned before, Melody mentioned before, you know, the 7 domains and some of the other trainings that she mentioned, those are required trainings through the state. If there's any cost connected to it, I usually have to.
You incur that
Yes,
cost.
yes, I incur that cost.
Okay, okay, thank you. And again, we'll be back to you later in the program. Sister Cynthia, shall we continue on?
So Theresa now will ask the others on the program in sequence that she's planned. Thank you, Theresa, and thank you, Davida and Robin.
Jocelyn is here from Catholic Charities, and we have a few questions for you, Jocelyn. Again, we're going to talk about access. Do many of your mothers that you work with, I understand it's a mentoring program, correct?
Yes, we match at any age mom with a mentor in our program, and then we also provide classes on different subjects and socials, just so they can build that community.
So do you encounter that the mothers you work with have any difficulty with access to high quality childcare?
It's not that there's not access or the availability. They know it's out there. There is that great, as you have talked to the 2 facilitators here, that there is great childcare out there. Some of the things that they run into and accessing that is whether they have transportation to get them there. And again, then it goes to affordability, but that's the biggest thing. One of my parents I have asked, even when they had childcare or if they're looking for childcare now, they know there are good programs out there. They know that, and that's not the issue. It's affording that childcare and transportation, because when you're working with low income, sometimes they don't have a vehicle, or the village, like I have a few now that the vehicle is broken down and they're trying to save to fix the vehicle. So that is the.
So in their case, it would have to be within walking distance, and and they're not there. They're not in.
Yeah, and it's in some, especially if you get into North Omaha here, there are some they're kind of like deserts, like a food desert. There's also a daycare desert in that area that there's the quality, it's not within walking distance.
That's what I found in my research too. So hopefully some of the information we're gathering tonight will help you help them. The other topic I wanted to ask you about is the workforce pay. So are your mothers trying to go back to school, and is that a stumbling block for them to find childcare, because school isn't always the same hours that the daycares are open? Can you speak to that, please?
I have a few of them that are going back. They're wanting to go back to get their GED or to further their education. The issue is with doing that, they also have to work to pay for that education. So now you have a student, whether they're student in day, work in the evening, or vice versa. So the problem is the hours that they need, whether they need somebody to watch their kid 3 days a week in the evenings or that type of, so that occurs. I have one mom that's going to school in the day and then works an evening shift from like 2 to 11. Well, grandma's home, but grandma can't watch them all day and all night. So her problem was she could get her child to daycare. She didn't have a way to get her child back home. So she relies on friends in the daycare to transport her child home to grandma for the evening while she works in the evening and goes to school in the day. So without that availability of friends and family, that wouldn't be feasible for her at all. She couldn't go to school and work or pay for school. So.
Jocelyn, you have a big job.
It's a good job. They're wonderful moms, but there's a lot of issues on trying to they want to better themselves, but in that process, they have to make money to do that, enough money to pay for childcare and for schooling too.
Well, it's encouraging to know that they have a resource in you to help them put all those puzzle pieces together. Thank you. And like I said, we'll be back later in the program. Next, we have Melody and Dina. They're here from the Department of Early Childhood Education. I'm sorry, is Dina here? Melody? Oh, good. Okay, so I'll put the question out and you two can decide who wants to answer what question. Again, we're going to speak about access. And my question for you on this is that we'll hear about a lot of the programs that you all have and opportunities for training. Are these programs also accessible for some of the childcare providers that Jocelyn was talking about, grandma and aunts and uncles that fill in? And if so, could you explain a little bit about those, how they could access those resources?
Okay, so like what you said, we're from the Nebraska Department of Education, Office of Early Childhood, but we have a special part of our team is at the Early Childhood Training Center. And just like it sounds, what we do there is specifically training for providers and families. And you'll have in your in some of your resources a link to what's called the NECPERS. It's the Nebraska Early Childhood Professional Record System. And on the main page, there's a button you can click that says training. And that will give someone access to a training calendar that has all of the license required training, as well as other trainings that are available. And any parent can take the training if it's a public training. And we have a lot of other, besides what's required, there are a lot of other child-specific training events. The other thing that the training center has that I think a lot of people don't realize is we have a free loan library, and that the records of the materials that we have are all accessible. And so you don't have to be in the metro area to check something out. You can go to the training center. It's housed at ESU 3 in La Vista. And you can walk through and like a normal library and pick out what you're looking for. And we have things that are applicable for parents and grandparents and resource books. And we have, I think, a few even cookbooks of things children like. But we also have curriculum and we have specific training, and we have a lot of videos, training videos. And so if you are not in the Omaha area, you can always get online and search what we've got, and it's a free loan. So you can check out materials, they'll be mailed to you, and then you mail them back, and there's no cost to the provider or to the family.
Do you find that this is kind of the best kept secret, that when people find out about your service, They're surprised you're
You
there?
know, so I think sometimes because we're in the educational service unit, people just assume it's all for K-12 and for, you know, for public schools and things like that. And that, yeah, I think we're a pretty well kept secret. You know, people who know that we're there, of course, we haven't had a lot of in-person traffic during the pandemic, but we hope things are getting back to normal. And so, yeah, we love to have people come through. And if there's something that you need that you don't think that you can find, somebody can always give us a call. And we have people at the training center who are wonderful at helping people narrow down what they want to find and how to get it. So I'll turn it over to Dina now.
Okay, thank you, Melody. Yes, I'm Dina Johnson, and I am the Child Care Resource and Referral for Nebraska. Thank you for having me here today. What Child Care Resource and Referral does is I assist parents and guardians in finding childcare. So let me share my screen here real quick. And, oh, I lost it. There we go. Sorry. Okay, so here is a website. It's called the Nebraska Child Care Referral Network. It is, the web address is nechildcarereferral.org. You can enter your address here. You can select how many miles away you want your provider, and you can choose open enrollment or all, and then find a provider. You can also do an advanced search where you can click to see if there are family home care, if you prefer a home provider, a child care center, a preschool or school age only, infants, toddlers, preschool, school age, if they speak Spanish. So all this information is on there. And then as we scroll down, you will see these providers, and it gives more information as far as the hours that they're open, if they're included in Step Up to Quality. Step Up to Quality is a program that providers can register for. And what that does is
it's a voluntary program for child care providers. Sorry. It's a voluntary program for child care providers that that if you want to be a part of that, then there are some benefits, certainly. And it goes above and beyond what child care licensing requires. And so there are specific criteria, and that and there are steps from 1 to 5. So people who are just starting in Step Up to Quality, will be a step 1, but as they get more training and as they do some other things, they can be a step 2. And then finally, there's coaching available. It's free to all providers. And the coach can help a program determine what their strengths are to help accentuate. And it can also program can be rated, and then this can also serve as kind of a mark of quality, so that families who are aware of Step Up to Quality, they can look for that mark, and they can see where they are and see if they're any close to them.
So if I put in here like a 1 mile radius and I put the show map, it will show me the providers within that area. And so you can click on them and it will tell you about that provider. So it's very user-friendly, easy to get around. The other program we have that Melody had spoken about earlier is the NECPERS. And this is where you just log in, set up an account and log in, and then you can view the calendar, and it will show you different trainings and when they're available. And then you can click on it and get more information and find out how to register and figure out if this is a training for you.
And if you're like a family member, like a grandparent who's caring for their grandchildren, or an aunt or an uncle who just wants to take some child development or some activity classes, you don't we always encourage people to get an account. But even if you don't have an account, you can search the calendar just by clicking on the training button there.
So my next question or topic I'd like you to speak to is the affordability. Is there tuition assistance if a child care worker wants more training but thinks she can't afford it? Could you speak to us? And then
Sure.
Is that available to individuals as well as facilities, or just licensed daycares?
One of the things we try really hard to make sure that training is affordable. However, if you, like Davida, if you have a dozen childcare providers who work for you, getting all of that training, it adds up. So, and we do understand that. There may be, with early childhood, there's a hodgepodge of things. People who are in Step Up to Quality, programs that are in Step Up to Quality, can get some of their early learning guidelines training at half price. So that's one of the benefits, we think. And there are sometimes in some communities have different programs, like Communities for Kids programs across the state who may have some ability to privately fund some training. But by and large, it is something where there is a big gap. Any training in and of itself is not necessarily all that expensive, but doing that for a number of individuals in a center or getting a lot of training, it can add up.
Thank you. The last topic and a question I'd like to ask is, do you see a problem with, I've read that some child care workers, especially during the pandemic with all the stressors we had, they love their job, they're good at it, but they found out that the pay is better, say at Walmart.
Yeah.
So do you see this as a problem we're losing?
Absolutely. In a previous lifetime, I was a child care director, and we would lose really good, very wonderful people because they could not live on what we could afford to pay. And yes, that is a problem. And it's a problem for our children, very specifically, because what we know about child development is that the majority of the brain is really truly formed in the first 5 years. And one of the things that we know is that a well-trained teacher or provider, or caregiver, is much more likely to have better outcomes with the children than someone who isn't, or someone who, is new on the job. And children really need a safe, secure place to be. And when you have a child care provider who has made an attachment with a caregiver, and that caregiver has to leave because they can't afford to survive on the pay that providers really have to pay, then that child has to make another attachment with a whole nother person. And it can be very detrimental to their long-term trust issues, and as well as their learning, because you don't pay as much attention to somebody if you don't know them and don't trust them. So it does have a real negative outcome for our children.
Children bond to their caregivers, don't they?
Absolutely.
And it's a sign of a good facility that can retain their workers. I know you said you have a lot of long-term.
Yes.
Yeah.
Mhm.
Yeah. And Robin, I know you have two, right?
Yes, we have a number that have been there since we started, or have been there 7-8 years.
Yeah, that's wonderful. Okay. Is there anything else Dina or Melody would like to add right now? I realize I forgot to allow you to give your opening statement, so
that's all right.
And I will go back I will go back and let Jocelyn have a chance to do that if she wants to. Do either of you have anything else you'd like to add,
I
Dina?
would just like to say that if you need help finding a childcare provider, you can reach me at dina.johnson@nebraska.gov, or my phone number is 531-205-9080. Almost forgot it there. Also, if you're looking for a childcare provider, you want to ask a lot of questions. You want to start early, like Robin had stated. There are waiting lists. So if you're looking for a job, you need to be looking for a childcare provider. If you are pregnant, you need to start looking, because there are waiting lists, especially in the higher quality childcare system programs that you want your child to be in. So get on those waiting lists and start early.
And Dina has some wonderful resources to help families. If you have a family that you're working with who's looking for childcare, she has some wonderful resources about things to ask childcare providers. And childcare providers, are prepared to answer, what they do with children, things like that. But there are some very good resources for families to help guide them in their search.
And both of you, don't you agree that going there and observing, just
Yes.
getting a feel for
Absolutely.
school could be high quality, but
Absolutely.
one classroom might fit your child better than the one.
Absolutely. Absolutely.
We recommend that you interview 3 providers and you interview each provider 3 times. So the first time is going to be a phone call. The second one is going to be an in-person, and you're going to ask lots of questions. If a provider starts getting anxious about your questions, then that's probably not where you want them to be. A good provider is going to answer questions you haven't even asked, and is going to invite as many questions as you have. So know that your third visit, we tell them to go the next day or a day or two later and do a drop by and say, I'm asking one more question. And that's to find out, is the program still clean, or did they just clean it while you were there? Are they on schedule? Are the babies that are upset, are the kids happy? Some babies aren't going to be happy. Are they being tended to? Or is there a child sitting in a high chair, dirty, and nobody's even paying attention to it? So you want to look for those types of things. And you also want to ask them, one important question is if you can do drop-in visits while your child's in their care, meaning you don't need to call ahead or schedule a visit, you just pop by. And if the provider says no, then that's probably a red flag for you. So you should be able to stop by the child care program at any time that your child's in there.
Now, we know coming out of
COVID.
Yeah, we know coming
Yes,
out of COVID.
COVID is an issue.
Yeah.
And
Yeah.
on some of these things you can't do, but do what you can.
Yeah,
And then
absolutely.
last, once you've hired your provider and your child's in their program, become part of the program. Have a relationship with the provider. Think of that provider as another person raising your child. They're another partner. There you have the mom, dad, 2 moms, 2 dads, whatever, but you have a third partner, and that's your childcare provider. And if something is going on at home that is maybe causing your child to have behaviors in the daycare, your provider needs to know that. So keep those communication lines open. It's very important.
Melody and Dina, thank you. This is a wonderful information. Joycelyn?
Well, one thing, I was an early childhood special ed teacher for a while, and one thing you want to look at is make sure it's developmentally appropriate. The early childhood office can give you information on that. So when you walk in, especially Montessoris are great. They work at the level of the student or of the child, but sometimes whether it be a home licensed daycare or even a sender, I have seen them where they're pushing the child at a level that they're not ready for. They all learn at the different rates, and we want to make sure you can't walk, before you roll over. So you want to make sure they are doing things that are developmentally appropriate for infants, for toddlers, or whatever. And sometimes they do. I remember one of my kiddos in my 3 to 5-year-old was coming from a daycare, and they were having pencil and paper activities for all day, tracing things. I'm like, wait,
No.
this is not
No.
developmentally appropriate. So that's one thing that you
Absolutely.
guys can help the parents look for and give
Yeah,
them kind of.
parents sometimes think, because, they're not the professional, they're the mom and the dad. They think, it'll be better if my child knows how to do all this before they come to kindergarten. But that's not how they learn. And a child care provider can tell you, we're playing with, bits of paper and we're gluing them on, and this is what it does for the child's fine motor skills. And they like doing this. And they're going to learn a lot more than if you force them to sit down, because I don't know if you know how many 4-year-olds who really do a good job of sitting for long periods of time. That's inviting some behaviors.
And Joycelyn, that's one of the many questions. I have a list of questions for parents to ask when they're doing their interviewing, and they can make several copies so they can highlight the things that are important to them, ask the questions while they're there, and then take the papers home after they've interviewed several providers and compare and make that choice of which provider is right for their family. So yes, you want to ask what kinds of science they're doing, how much time do they watch TV, how much time do they spend outside, what do they eat, who feeds them, things like that. Where do you keep your cleaning products? So you want to, there's probably 50 questions on the list that I have that parents can review. So again, contact me and I can get that list to you.
It sounds like you're saying, don't take anything for granted. That if you lock your things up, don't assume that they do.
Right.
Go ahead
Right.
and ask. Okay.
Right.
Joycelyn, is there anything else you'd like to add, since I forgot to allow you to give your opening statement? Did we miss anything? Go
I
ahead.
don't think so. I think you've covered it, talking about the different facilities and the affordability and whether they can. And obviously there are great facilities out there for these parents, but then for my parents in my area, that most of them that I work for, it is hard for them to get to those better programs.
Yeah. Well, then, as a society, we need to train all the programs to be quality programs. So,
Yeah.
Okay, thank you all three for speaking with me on this. I'm going to move on. So our time doesn't get away from us. We're going to speak with representatives from Voices for Children in Nebraska. We have Aubrey and Alfonso. Welcome. Again, we'll start with access. And I'd like to just let you go ahead and say an opening statement if you'd like to. So if you have prepared remarks. Alfonso, do you have prepared remarks you want to say, or Aubrey?
Hi, good evening, everybody. So essentially the way we presented, first I'd like to say thank you, everybody, for all that great information you all have provided. I think for us, especially for me, that's the research coordinator, I like to, usually what I do is I take a look at the 10,000 foot view, right? And a lot of the things don't seem very obvious to me when I'm looking at from such heights, right? So essentially what I do is data, and then looking at how certain policies could affect, child well-being after they're implemented or taken away. And so it is important for us to hear also what's going on in the ground, right? And what's really the reality for the providers and for the people who are actually, experience, all these changes, right? So yeah, I appreciate that a lot. And so for us, I think what we wanted to do here today is explain a little bit about the 10,000 foot view, right? Both in terms of policies and as well as data, right? So I am going to present here my screen real quick. Let me see if I can share it. Sorry. Can anybody see this okay?
Yes.
Fantastic. So yeah, so I will let Aubrey kind of start presenting this, and then I'll go through some of the data in a bit.
Yeah, so again, what we like to do is kind of zoom out and look at the big picture and think about what are the ways that policies and systems work to impact some of the issues that we've been talking about tonight. I like this slide because it shows our federal spending on children. It's a little bit hard to see, but if you look at this blue slice of the pie, that's how much we spend of our federal budget on children. So it's only about 9%. And so that's not a lot of money. And I think that's important to consider because when it comes to kids, kids are really a good investment because the issues that you're addressing, whether it comes to quality brain development, healthcare access, early nutrition, all of those things are really important when kids are young. And so it is a little bit disappointing that we collectively spend so few of our federal resources on children. And when you add in state spending on children, the picture gets a little better, but it still doesn't really equal out in the way that it should. Can you move to the next slide, Alfonso? A lot of this has been talked about, but childcare for families with young children is the most significant monthly expense in the budget. And so you heard that. And then you also heard from the providers. The unfortunate thing is that in spite of the high cost of childcare for parents, we still are not paying providers enough. It ranges from about 26 to 33% of the monthly budget for families with young children. And a family's ability to work can be limited by access to affordable childcare. And the last point I have on there is that a minimum, children need safety and ideally they need quality. And so I think it's always important to start at it from that perspective is how do we get to a place where we ensure that families have access? And then moving beyond that, how do we use resources like the Step Up to Quality program to strengthen the quality of care provided? Next slide, please. And a lot of these issues came up tonight. Affordability, will I earn enough to cover the cost of care? And these are all kind of from the parent and family perspective as opposed to provider. Access, are slots available? And does the availability of childcare fit my schedule? Families who work non-traditional hours still have huge issues with access to childcare. That continues to be a significant kind of hole in the childcare market where families struggle. Some rural communities in Nebraska also have significant issues with the availability of childcare. And of course, as has come up tonight, infant care is a big deal. And I laughed at what some of the folks said earlier, because I think each time I was pregnant, our childcare provider knew before any of our family members did. So that's a very real thing. And finally, quality, which has been mentioned as well, is the childcare setting following best practices in regard to child safety and development. Next slide, Alfonso.
Yeah, and so here, talk a little bit about, so about those three things, right? Mentioning about, which was again, affordability, access, and quality. And so I'm going to take a look at the state of childcare in Nebraska today in those three lenses, plus an extra one on equity, which I think it's also an important lens that we should look into this. So in terms of affordability, right? We see that, sorry, was mentioning, it is one of the most expensive things for families to have, right? So in terms of the annual childcare costs for a family, it is around, in Nebraska, it is around $12,000, a little less for 4-year-olds for center-based care, but around the $12,400 for home-based care as well. So it is a very, very expensive aspect, right, of families' lives. And to put into perspective, right, so for example, a single parent working full-time at the Nebraska minimum wage would earn $18,720 of pre-tax income, right? So that's earning $9 an hour for 40 hours a week for 52 weeks, which if you see 18,000, closer to 19,000, it is very, very small compared to the annual cost, right? And of course, that's where we many families receive subsidies, right? So in Nebraska in 2019, there were around 3,000 children who received childcare subsidies, and about 1,700 of them were in a care of a licensed exempt facility. And of those who received a subsidy, 18,394 were earning an income below the federal poverty line. Around 5,000 were between 100% or 130% of the federal poverty line, and around 2,700 were from between 130% to 185% of the federal poverty line. And this is going to be important in a bit once we look at this. But of course, the assistance out there is not going to help everyone, as we see right in 2019. Around 1 in 20 parents, so 5%, or 8,600 parents had to change dramatically their job or quit because of childcare problems, right? So that is a big issue, and specifically, right, for parents who who are struggling economically, right? And again, this is something that we already touched on. The second aspect is access, right? And this is something that we publish in the Kids Count, which if you're interested to learn more about this, we provided there. But we pulled the official roster of licensed childcare centers for the ones that are not exclusive only to school age children. So anything from that accepts children under the school age, which would be under the age of 6. So what we see here is that what we here do is a ratio of the number of childcare seats per 100 children in each of these counties, right? So that in a way to say, right, how much of a gap there is. And it's not all children, it is children ages 6 and under 6, under 6, who have all available parents working, right? So it's a very specific narrow definition of who needs child care in Nebraska, and this we use this as a proxy to see, for parents who are working full time, who need to leave the kids somewhere, right? Do they have access in their communities to do so? And so we see that in 2020, it's a quite disproportionate, right, throughout the state. The grays means that there's no facilities in here, and this is something that Aubrey was mentioning. Then in some of the rural areas, there might not be any facilities or childcare centers where parents can leave their kids at. Of course, it is important to note that they also have a small population, right? So, like the bigger impacts, for example, would be in the in the metropolitan areas, right? But we see that it is there's a big difference county by county, right? And there's really no discernible pattern in here. But one pattern that's important to note is the difference between 2020 and 2021, right? That we see, particularly because of the pandemic, we see a decrease, right, in number of childcare centers, number of childcare seats, while we see an increase of children who need childcare, right? So we see, for example, the most stark would be the darker orange, right? Which we see we had quite a bit of these counties where had 100+ seats for children, and we see that pretty much everything on the east side of the state, went lower than one childcare seat per child who needs it or more. And so, for example, this affects pretty much the Douglas County where Omaha is located, where we went from having one childcare seat or more per child who needs it to 75 to 99. And so, so the decrease, for example, when we see the number of childcare seats available to the number of childcare children who need childcare, that ratio decreased from 78, right? 78% of children who could have a seat would have one, to 75.8, right? So we did see this decrease because of the pandemic. And lastly, of course, well, the third thing is quality. And this is something from our kids count here. We see the system that it rates, right? These childcare centers, right? Step up to quality. We see that there's been a steady increase in these programs available, right? And currently, some of the best programs, which is either meets quality standards or above, so 3 to 5, we see that there's 125 available as of last year, right? We have yet to pull the numbers for this year, but we do note that this is an increasing trend. But of course, this varies very much by your neighborhood, right? So for example, Douglas County may have 121 step up the quality programs, but they may not be distributed evenly throughout each neighborhood. And lastly, here's like an extra step to look into, and equity is particularly by race, ethnicity, and wealth, right? So when we break down this, the same chart that I was showing, the same map I was showing you about the number of childcare seats by the number of children who might need them, same definition, children under the age of 6 with all available parents who are working or in the labor force. But when we break it down by zip code, we see that there's quite a disproportion in some areas, right? So for example, South Omaha, right? We see that there's very little in some of these neighborhoods, right? Very little availability for childcare centers, right? We see some areas also in North Omaha as well. And this is all in terms of all facilities. But when we look at facilities that accept subsidies, and again, the caveat being, this is data that I got from the official roster from the state of Nebraska. There might be some data that may have changed, right? We see that the availability goes down even lower to where, there might be something in this zip code to there is no facilities that accept subsidies in this neighborhood right here, right? So we see that there's a decrease in access when it comes to those facilities that accept subsidies. And that is important specifically because we see, right, this the distribution, right, of poverty rate, right, in each of these neighborhoods. We see, of course, that this area of Douglas County, right, has the highest rate of poverty. But we see also, right, the South Omaha, right, even though there's a very high ratio of poverty, right, there's very little childcare seats available. So we see that there's some disproportion there. And this one, this chart, and this is a bit much harder to explain. So here I'm looking at the children under 6 in Nebraska. So this is the entire state. Again, with all available parents in the labor force, by poverty level and race and ethnicity. And I'll get to some of these levels here in a second. But we see that for children whose all parents are working, for African Americans, 33, so 1 in 3, still live in poverty, right? So parents could be working full time and still be living in poverty. A little bit less than 1 in 2 Native Americans, right, children live under the poverty line, and this goes down. But what we see here, in particularly when it comes to the policies to increase the eligibility for the access, right, to childcare subsidies, we see that it would be much more beneficial to different groups like African American, American Indian, and Hispanic, because a very vast majority of their child population under 6, with all parents working, have an income, right, below, right, the 185% of the federal poverty line, which is pretty low. So we see that again, this affects different populations differently. And here's and I think it's important to note, this is just one issue area, right? When it comes to childcare, there's many different things that are affected by it. And I'm going to run through the commentary that we put in our kids count report. I'm going to skip through some slides just because there's a lot of data here, but just to kind of give you a little bit of the gist that, although we're talking about childcare, we have to also consider all the other aspects that these families are have to consider, right? So yeah, although childcare might be one of the most expensive things for families, they also have to account for housing and food and so many other things when it comes to affordability, right? So what we did for a commentary, and here's what's a little bit of the gist of it, is that in 2020, as we remember, and even in 2021, there's just huge turmoil, right? With COVID, huge unemployment, lots of people getting sick. 41% of all Nebraskans reported loss of income. 2/3 of parents reported feeling down or anxious, compared to 41% in 2019. And 1 in 20 Nebraskan children reportedly rarely or never having a computer or internet available for educational purposes, which makes education, remote learning, virtually impossible, particularly during 2020. So it was a very dire situation throughout the country, but also specifically Nebraska. But we did see that the effects of the COVID-19 pandemic have been disproportionately devastating for families of color. And this is when we get to the issue of equity, right? And three results that we saw from a research study on this is that in Nebraska, the overall experience of families of color prior to the pandemic had been more dire than white families experiencing, this outcomes during 2020. And then since the pandemic, families of color have fared worse in Nebraska than many families in other states. And in Nebraska, families of color have experienced worse economic and health outcomes due to the pandemic compared to white families, right? So essentially, what we found out is that families of color have fared worse before the pandemic, and their outcomes went even, the disparity went even deeper due to the pandemic. And here's some charts. Again, I'm going to skip through some just to give you a little bit of what it's like, right? We see that, for example, the death rate for African Americans has been significantly higher, right, than for non-white Hispanic, non-Hispanic white population, and same thing for American Indians, right? But we see that during 2020, this estimate, right, we see that because of COVID, that death rate increased. It is still lower than what has been in previous years for other populations, and each of these dots represents one of each year's death rate. Here's another big impactful one: food insufficiency for households with children. Before the pandemic, 42% of African American households with children experienced food insecurity, and increased to 45%, but it is much, much higher, right, than what white households with children had experienced after the pandemic. So 8% of white households experienced food insecurity, which is, again, lower than all the other groups. Here, we see that for percents who are housing insecure, same thing, African American parents, 50% of them, right, were housing insecure. 42% Hispanics are housing insecure, and only 13% of white parents. So what we see with this is that, again, through the pandemic, it's a big reality, right? A lot of data that we have is outdated, but this gives us a glimpse that these issues affect much more than just childcare center availability, but also, right, employment, housing, and other types of welfare for our children. And I'm going to let Aubrey finish here a little bit of the policy changes that have been going on to childcare.
Yeah, I know we're running short on time, so I'll cover this quickly, but there is an increase in childcare assistance eligibility going into effect in October of this year. It is currently temporary for 2 years, but this is a mechanism for helping families afford childcare as they continue working to recover from the economic impact of the pandemic. And Sister Cynthia had mentioned this in the beginning, but the improvements to the federal child tax credit mean that a lot of families are currently getting monthly payments to help offset some of the expenses of raising children. And if you're working with families who aren't getting this, you think may be eligible, there are lots of websites and tools to help folks apply for this. And just go to the next slide quickly. I don't like to present problems without solutions. So just quickly thinking about what some of those are in these areas. So spreading the word about this expanded enrollment for childcare assistance is really important coming up to October. And then advocating at the Nebraska legislature for continued investments in childcare assistance. And finally, advocating for making the recent improvements to the child tax credit permanent as well. And with that, I will turn it back to Theresa and Sister Cynthia.
Okay. Alfonso and Aubrey, thank you so much. You covered all the topics I had questions on. So we can, and very important information. Thank you. And I think this leads real well into our guest from Appleseed, Nebraska, because I know one experience I had with them is getting petitions signed. So if you would please speak to us about access, affordability, and workforce pay, any of those topics when it has to do with young children, I'd appreciate it.
Sure. I think the slide just went away, but
sorry.
Oh, that's okay.
There we go.
Yes. I myself with Appleseed and Voices for Children is a part of this too. We're working hard to get the Nebraska minimum wage increased through a ballot initiative. It would increase the minimum wage to $15 an hour by 2026. And what folks can do today is pledge to sign the petition, visiting the website that's there. That's it's p2a.co/NDTUNFT. And we will make sure that someone goes to you and gives you an opportunity to sign that petition so we can increase the minimum wage in November during the election. So that's what our hope is. And if folks are interested, they can also call me or email me if they're interested in collecting petitions as well. My phone number is listed there. It's 402-802-3053. But yeah, I will pause there, and I don't know, Aubrey or others, if there's things to add there, but that's a really big, important piece that we can all do today.
Thank you, Selena. And I just had one question for you. Are there any other things that the Biden administration is working on that you see coming down the road that we should be aware of when it comes to federal money, more federal funds becoming available to help families with young children?
I don't know off the top of my head. I would just echo kind of what Aubrey said earlier, both on the state level, because I do think a lot of families aren't aware about that expansion. And I think that's really important. And then I think families too who are, you'd be surprised, families who are needing to take some steps for that child tax credit. And yeah, so I think those two things are really important to get families connected to taking the steps that they may need to take in order to access those funds.
Thank you, Selena. Now we'll go to Molly if she has any questions that came in from our Facebook watchers. Or Sister Cynthia, do you have those?
Oh, I do not have them. I was just noticing we have about 4 minutes. So Molly, was there something you wanted to make sure we lifted up from our attendees on Facebook? And then we will draw to a close. Maybe she went to the senior center. I don't know. Okay. I had a question for Joycelyn, and that was, did I miss it because I was distracted by a call here? What was the ages that you have for the mentoring moms, or is it any age of mom.
It's any
Or
age of
any
mom.
mom or pregnant. Just tell us about that. Okay.
Yeah, with the mentoring
It's
moms.
pregnant moms and the young.
That's how it started. It first started for pregnant and new moms. It was to help young teen moms, and it was to what do I want to say? To honor life. And so it wanted to give those moms, new moms, support. Well, now we know whether you're an older mom, a younger mom, being a mom is a lot of work. And so, as I say, we try to help them as best as we can. We want somebody in their corner to help them. So initially it was for very young moms, new moms. We have moms of all ages now, because whether you're 30 or whether you're 19, we all need that help and support. And so that's what we're there in the corner for any mom. And actually, you know, a lot of our activities, dads, if they want to come too, it's to support that family unit, to build that healthy family unit and communication. Then we communicate well with the kids, and then we communicate well with others, and we start building that education and broadening those abilities for those families. And so, yeah, at first it started out as over 10 years ago, it started out as for young moms, but it's grown. So it's a vast age. Any mom can. And if you're a mom and you have older kids and you still want that support, you can still join Mentoring Moms.
And I found Joyce Lynn, and I was calling her Jocelyn first, but I found Joyce Lynn by just putting Catholic Charities, Mentoring Moms, and that's how I actually found her name and contact. And once I heard about it, so any of our listeners, you can pursue that. I'm going to return.
Sister Cynthia.
Yeah.
I forgot to recognize that Victoria Jones is here from Voices for Children. And just if you had one or two sentences you'd want to say, we can open it to you, Tori. No.
Anything? Because
I'm mostly here to run help with tech support, but I appreciate all of the work that you guys have been doing while I've been here.
Tech support is very important. Thank you. I'll turn it back to you, Sister Cynthia.
Okay, I wanted to come to this slide because it just lists the names again of our guests who've been with us. A lot of resources. You can reach out to us at Notre Dame or any panelist person that you met here. Selena had a good thing on the wage thing because it came up with the affordability, and that's the action. So I thank you, Selena, for adding in there toward the end. I'll just do this letter up there in the corner and just do, I found out by Googling this, looking for the coalition members, that there's lots of groups. So just put in this pledge to raise Nebraska and watch for this ballot petition coming around. The next take action is a request for anyone listening or pass on the word. The Notre Dame Sisters fund the self-fund the safe homes, and we're doing fundraising for it, and we're out looking for ways to help get that $500, $250, and $100 so that we can continue our ministry of investing in children. And then these children are going to need what all our panelists have been talking about, and so much information. I want to just thank everybody. And just a quick announcement, we will have an October 21st, third Thursday. It's 8:30 by my clock. And I'm visiting with Dr. Donna Polk, who was on our program in February on racism. And she will be helping us understand more of the challenges of the Nebraska Indian urban Indian from the Indian Health Coalition. And Molly was going to speak just briefly about October 21st. She was there. Is Molly with us now?
No.
Okay, the third Thursday is October 21st, which surprised me when I was looking at this because I was planning Mass, and this Kateri Takawitha had a feast day. But then I found out the third Thursday is her canonization, which in our Catholic Church is the way we raise up people for their holiness, for their work with others, for their reaching out. And she's the first Aboriginal saint from Canada. So it just happens to be her feast day. So I bring that forward. And at this point, I want to just go into my thank yous. Just trying to have not this in the corner, but to everyone, and I'll name you, is Joyce Lynn. She was our, you can see the representative. Becky and Robin were originally on this list, so I just kept them there, but Robin represented that, the Hills Montessori. Aubrey and Alfonso, a big thank you. Selena was popped in late for us, and we're just glad you were able to come forward with that information of the wage, because it sounds like it fits everything. And Davida sitting there with Theresa. And then, of course, without having the professional training and access information like Melody and Dina gave us, this whole system would be kind of haphazard. So I want to thank everybody for that. And this is the point also. Molly is our communication person. So we provide email that you can email us. If you want to just call our office for more information, that's real easy to see there, 402-455-2994. And Molly
Yes,
keeps
and
us.
you can also like us on Facebook. I hope you're all watching us right now at Notre Dame Sisters Facebook page, or you can follow us on Twitter or Instagram. And as Sister Cynthia said, you can send us an email, send me an email at mmullen@notredamesisters.org, and that will get you on our email list so that you can see what our next several upcoming Expand Your Horizons are, or what we're doing in the community. And then you can also just, if you have a friend who's not on Facebook, you can go to our website tomorrow, notredamesisters.org/news, and we'll have all of these slides up and available, as well as the video of this lecture, so that everybody who wants to know more can know more. Thank you, Cynthia.
So to all, and to Molly for organizing this for us, and to all of you for your energy. May God bless you in whatever way you get spiritual energy. May it be with you, especially after this late evening and a full day of work. So, and with that, we'll just wait a few moments and then we'll be offline. Thank you to all our attendees. We hope you did send something in that we have to think about.
Thank you, sister.